since we always get questions about the recordings. We will have it recorded and be it on our YouTube channel. So welcome, and today we have supports and services for children and youth with special healthcare needs. We have two very special guests. Actually, we have more than that, but our two speakers today will be April Hearron. We'll be talking first about the EarlySteps program. And then we have Ricky Richardson, who will be talking about TEFRA Act 421. So April is the provider specialist with EarlySteps and former regional coordinator for Region 7. And Ricky is, I can't remember what his, his credentials were as far as, but he's the MEDT, is that it, Ricky? You can speak up and let me know. He'll be on. So you're on mute still, Ricky.
Ricky's the RN assessor at the local governing entity, Northwest Supports and Service. I'm sorry, Northwest Louisiana Human Services
District. Yeah, and we'll have that too. We'll give you more details when it's their turn to speak. So we'll go ahead and start. And this is being presented by Families Helping Families Region 7 and Families Helping Families of Northeast Louisiana. And we do have a disclosure. This is under a project with the Department of Health, Louisiana Department of Health, Bureau of Family Health. Our disclosure is the following. The Bureau of Family Health is approved as a provider of nursing continuing professional development by Louisiana State Nurses Association Approver Unit, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. LSNA provider number 4003257. The event planners and presenters have no relevant financial relationships to disclose. Nurses must attend the entire event and complete evaluation to receive continuing education award. So for that CE certificate, the entire event. This activity has also been submitted for approval to the Louisiana Department of Health, Office of Public Health, Bureau of Family Health for 2 general contact hours of social work continuing education. The Louisiana Department of Health, Office of Public Health, Bureau of Family Health is an authorized approval organization of the Louisiana Board of Social Work Examiners. Presenters have no conflicts of interest to disclose. Social workers must attend the entire event and complete evaluation to receive continuing education award. And also the views expressed by the presenters do not represent the opinions or policies of Louisiana State Board of Nursing or the Bureau of Family Health. Thank you. Okay, so now moving on, we have Ms. Stacy Guidry with Families Helping Families in Northeast Louisiana. This is going to give us just a brief description of Families Helping Families across the state.
Thank you, Monica, and thank you everyone for joining us today. For those of you that aren't familiar, we wanted to tell you a little bit about the Families Helping Families Network. Families Helping Families is a network of 10 independent 501c3 nonprofit agencies. Each agency is governed by their own volunteer board of directors, and there's one center located in every Office of Citizens with Developmental Disabilities regions in Louisiana. Each of our offices is family directed, and what that means is that the leadership and the program staff are parents of children with disabilities or individuals with disabilities themselves. So this means that we understand the challenges our families face when accessing services and supports for their children or a family member because we've been there. So we take our journey and we use that to help others navigate the service system and provide support to them while they're coming to understand their child's special health care need or disability. All 10 of the Families Helping Families centers provide at a minimum 3 core programs, and that is peer-to-peer support, education and training, and information, resources, and outreach. Okay, thank you. All of the Families Helping Families centers receive funding from the Louisiana Department of Education and the Bureau of Family Health. 9 of the 10 centers receive funding from the Louisiana Developmental Disabilities Council and the Human Service Authorities and districts. For Families Helping Families of Northwest Louisiana, that Human Service Authority or local governing entity is Northwest Louisiana Human Service District. And for Families Helping Families of Northeast Louisiana, that LGE is Northeast Delta Human Service Authority. Also, as part of our efforts to build effective parent advocates, Families Helping Families supports parents in learning how to participate in grassroots advocacy to support laws that advance programs and policies which support people with developmental disabilities wherever they live, work, and play. So we encourage you today to check out the LaCan's website at lacanadvocates.org, and I'll also put that in the chat to learn more about the LaCan initiatives. Thank you so much for joining us today.
Thank you, Stacy. That was fantastic. I'm going to go ahead and kind of talk while I'm doing this, because we will go ahead and switch over to April's portion. So April Hearron, like I said before, is the provider specialist with EarlySteps, and she was formerly the regional coordinator for Region 7 for EarlySteps. Are y'all seeing the new PowerPoint, April's PowerPoint on the
Yes.
screen? Okay, just making sure I'm getting everything
Yes,
right here. Okay,
Yes,
so I'll
you're
go
good.
ahead and turn it over to you, April.
Okay. Hi, welcome everyone. Thanks for coming to listening to about our programs that we have to offer for the state. So we just wanted to let everyone know about EarlySteps and what we can provide for families and who should be referring children to EarlySteps and those type of things. So EarlySteps is Louisiana's early intervention system. Every state has an early intervention system similar to ours for infants and toddlers who have developmental delays or a medical condition that has a high probability of resulting in a developmental delay. Families enrolled in EarlySteps receive services which help their children progress in their development. And we focus on the child's functioning as part of their daily routine. So we're more of a family education and training program. We want to work with the families and the caregivers, even children at child care centers, to help them meet their goals that they may be behind in their development. The history of EarlySteps, we are under the Individuals with Disabilities Education Act, and we are considered Part C of that. Similarly, the school system, special education for the school system is Part B, which is age 3 to 21. And so EarlySteps is the portion of that prior to school age for special education. We historically were, a long time ago, were ChildNet. And in July of 2003, we became under Department of Health and Hospitals, or now Louisiana Department of Health, and our name changed to EarlySteps. Who is eligible for EarlySteps? So as we talked before, children birth to age 3, so but not past their 3rd birthday. As I mentioned before with IDEA, as a child is getting close to age 3, they are, and turn 3, they're eligible for those special education services with the school system if they meet those requirements. So a child births to age 3, but not past their 3rd birthday. They must be a Louisiana resident, and they must have a diagnosed physical or mental condition that has a high probability of resulting in developmental delay, or they must have a developmental delay in at least 2 areas of one of our diagnostic tests we use. We use an evaluation called the Battelle Developmental Inventory, and we will assess the children as they come in and as they are referred to EarlySteps, and we'll look at all the areas of development. So physical, cognitive, social, emotional, adaptive, communication, and I think that's all. And so we'll look at all those areas. We'll do an assessment to see if they have a delay in those areas and what the concerns are. And then the next steps after that is developing our services plan. So these are some of our services that we can be accessed through EarlySteps. Traditionally, our most utilized services are going to be our therapies. We have physical therapists, occupational therapists, speech therapists, and our certified teachers, which are our special instructors. And then we have some additional services that for evaluation, those type of things that are listed on there. But the therapies and the education are kind of our main services that our families receive. All of our services, we're unique as all of our services are provided in the child's natural environment or community setting. So we're a little bit different than your typical clinic services for children with developmental delays. We are in family's home or natural environment. We also go to the child care center and can work with the child care centers in the classroom teachers for helping the child meet their developmental, meet their goals with their developmental delays. And we refer to that as the child's natural environment. So any setting which a child would typically be in for age birth to 3. It could be their home, like the child care center, as I mentioned, their park, grandmother's house. So all of our therapists and our providers and our service coordinators come to the home. We are doing some virtual visits for meetings and things like that. But we do come to the home to meet with family. And so we can look at what's going on in the home on a daily routine and give the parent or the caregiver activities that they can carry out through those daily routines on a regular basis, because we know that that's the best way the child will continue to make progress. I always like to relate it to if, as an adult, if you've had surgery or had to go for rehab to recover from surgery or an injury, we're all given activities and exercises that we're supposed to continue to do at home every day. And that's the same for early steps. As an adult, if we're just going to see our PT 30 minutes a week to recover from our surgery or injury, we're not going to make that much progress unless we do those at-home exercises. Same thing for the children, but since they're younger, we have to help the parents or the caregivers learn those activities that they need to work with them on during their daily routines. And I just explained that one. So you can go on from that. Went ahead of myself. So who should make a referral? Anybody can make a referral to Early Steps. Let's see what I was looking at. Excuse me. So anybody can make a referral. We want our physicians and our nurses and our child care centers, anybody who suspects a child has a delay in their development should refer that child to Early Steps. So we get referrals from pediatricians. We get referrals from NICUs. We get referrals from families, child care centers, grandparents. Anybody can call and make a referral. We, under the idea, we service approximately 2% of infants and toddlers in Louisiana. That's our kind of a current guideline that we have right now. It can go up and can vary, but approximately 2% of infants and toddlers with developmental disabilities are in Early Steps. I think currently statewide we have about 6,000 children receiving services from Early Steps. And like I mentioned before, our physicians in hospitals and public health facilities are mandated to refer these children because we want to know about these children so we can let the families know what services that are available to them and what resources they can be connected to within Early Steps. And not all families will continue with our services. Some may choose not to proceed with Early Steps, but we want to make sure that they know about this program and what's available to them. So like I said, anybody can make a referral, parents can call too, but we want to make sure that our physicians and our NICUs, when they have a child that they suspect or may have a medical diagnosis, that they go ahead and automatically refer those children. With infants and newborns, since they may not they're not old enough to necessarily show a delay in a lot of areas, but they do have a diagnosis if they were a preemie or they're born with Down syndrome or cerebral palsy, any of those type of things. Those children are automatically eligible based on that diagnosis. And so that's why it's important to refer from early on, so we can be there even before a child starts to show a delay. Referrals are very simple. We can send out our referral forms to the group, I'm sure, afterwards, and contact information. We have system points of entry, which are in every region in the state. We have 10 of them, and they are the system, the initial contact for that referral. So referral is made to our system point of entry, and then the intake coordinator contacts the family within 3 days to set up an initial intake appointment, and they do a little ages and stages questionnaire and screening just to see what the concerns might be. And then we would, after the screening, we would do that assessment to see if what delays are the child may have. And then once it's determined that the child is eligible for EarlySteps, then that is when we develop a plan to what to work on. So we involve the parent or the caregiver a lot in this process. And we develop outcomes based on what the parents want their child to improve on in the next 6 months to a year. And so we look at, okay, what are the areas of delay? What is your priority right now for milestone for them to accomplish, and who's best to accomplish that? So that whole process is what's called our individualized family service plan. And it is equivalent to an IEP in the school system, the individual education plan, but it's the birth to 3 version of that. And so in that plan, we have the child's outcomes and who's best to work on that. Is it going to be a speech therapist? Is it going to be one of our special instructors or physical therapist? And what activities and we're going to do to accomplish those goals. And so, and how often. So you might see that our providers are coming out once a week to work with the family on these things and to make sure that they have activities to work on in between the visits for the supports. In addition, the family is also is provided with a service coordinator, which are family support coordinators. And so it's essentially a case manager for the child throughout the time that they're in EarlySteps. And so they will have that support system too, for if they need additional resources or anything like that, they have those family support coordinators. So every family is given a family support coordinator along with any direct services or supports that they may be receiving from therapists. The whole process of from the time the referral happens until the time the IFSP is written should not take more than 45 days. And so that gives us time to meet with the family initially, schedule the assessment to determine eligibility, and then write the service plan. If the child is close to that 3rd birthday, then we're going to go ahead and refer them to the local education agency so that they can begin their process for evaluation directly with the local education agency, since it's so close to the time that they are in EarlySteps. Anyone, what I described before for eligibility, that's all that is required for a child to be eligible. Their delay or their medical condition, and they're a resident of Louisiana. Income is not looked at for eligibility for EarlySteps. So a lot of times a misconception may be that it's just for children with Medicaid, which is not always the case. So we have families who with Medicaid, we have families without Medicaid. We do have a family cost participation scale for families who don't have Medicaid. We do look at income information, and there may be a cost for those direct services, but there's never any cost for evaluation, IFSP development, team meetings, any of that. It would just be some families do incur a cost such as a copay for the direct services and supports that they receive on a weekly basis. I think I covered everything. Does anyone have any questions specific to EarlySteps? Like I said, we can send out the information to how to make a referral, who to contact. We can send out the SPOs for the whole state and referral forms that you can fax directly to the SPO, or you can always just give the call and make a referral, or email, any of those options. We just want to make sure it gets to the right region when we do receive it.
So we do have several options for asking questions. You can either put it in the chat, or you can put it in the Q&A, or if you want to raise your hand, you could raise your hand, and actually I've got several people that had their hands raised now, and I don't know if that is for questions. Some people have taken it off. So, so if you have your hand raised, I have two people with their hands raised. Is that, if you do not have a question, can you take your hand down? And then that way, now, if somebody has a question, you can, like I said, you have options here, because I think, and I'll just say real quick while we're waiting, if anybody, like I said, you can type in the chat, or you can type in the Q&A. You can ask your question in the Q&A section. And I did have somebody raise their hand. I'll go back to that, but there was something, April, I think. Oh, okay, because sometimes we might hear where somebody wouldn't necessarily, they made referrals and they didn't feel that there was follow-up or something. So I don't know, because you're like me, and like you already say everything and then like get ahead. You're like I'm on the next slide before it even comes up. So and I wanted to make sure that everybody knew about this. And I think
I know where you're going on this. So if you please, we will let you, if you do make a referral, and there's kind of like I said at the end, we want to make sure that it's going to the right source. Sometimes people will look on our website and try to determine what fax number to send it to, and our website has been updated recently. It should have good information for the referrals, the intake offices, and who to send the referral to. But if you do not hear anything, or the family says they have not been contacted, then you're going to want to contact that regional coordinator in that region, or call the SPO directly, because we have found that sometimes it goes to another fax number and it never really got directly to our SPO office. We will, if you are the ones making a referral, we will send you an acknowledgement letter that the referral was received. So that's one way that you know that we received it. The other thing is that sometimes families' phone numbers change frequently. And so we may get the referral and you may have put a phone number that you had in your file. That was the last known phone number for the family. But then when we get it and try to contact them, the phone's not working and we struggle to contact them. So always make sure we have the most updated information, and let a family know if you're making the referral that, hey, these people from EarlySteps may be contacting you to see, what services they can offer and stuff. So the families will know to call us back or answer the phone or respond, because it is a parent's choice to participate in EarlySteps. So those are some common things that happen, and definitely follow up if the family says they haven't heard anything, or you feel like you didn't get acknowledgement of the referral, because we do send an acknowledgement letter that we received the referral.
Another thing I wanted to point out too, because I think we talked about this at the QEP meeting. So on here it says they have 3 calendar days to contact you after that initial referral. And I think statewide, isn't it 4 days? But 3 was just our region 7 SPO, or is that 3 statewide? Can you clarify that?
I would have to look to confirm that for sure.
Okay.
So,
Okay. So, but with 3 to 4 days, that should be that. And that's usually what I tell parents when I do a referral. I tell them, first they're going to expect a call. And then they should actually have a visit within 10 days. So those are very important time frames that are make up that for a 45 days time frame. Okay,
yes.
April. I think let me see. I thought I had somebody with their hand raised and now I don't see it. So maybe it was something else. I don't see a hand raised. Let me look in. There is a Q&A. Let's go to Q&A. Okay, so this is the question. It looks like from Kelsey, it says, is our current coordinator going to be the one who also helps us transition into the school system at age 3? If so, are we able to change that person?
Okay, so I'm thinking maybe you're asking about your current EarlySteps family service coordinator. So they would, we work in tandem with the school system. If a child is in EarlySteps, has an active IFSP in EarlySteps, and they are between 2 years and 3 months and 2 years and 9 months, we will schedule one of your regular quarterly IFSP meetings, and we will invite the school system person and send any necessary paperwork to that school district with your consent. So we'll let the school system know what services they're receiving from EarlySteps, and that process begins between 2 years and 3 months and 2 years and 9 months. So we want a seamless transition so that the school system can do their evaluations and their necessary appointments prior to your child turning 3, so that at 3, they can pick up where EarlySteps ends. So the EarlySteps coordinator kind of initiates that first meeting with the LEA, but after that, the LEA just schedules their own meetings individually and their own appointments for evaluations and that type of thing. But if you are, and there was an additional question about changing, families always have the right freedom of choice of their providers. So if ever a family is unhappy with any of their providers, they can contact their service coordinator to change a therapist or a early interventionist, or they can call their system point of entry office to request a change for a family service coordinator. So that's always the parent's option to do that.
And I'm glad you brought up though about transition, because April just mentioned all the meetings that happen when transition happens, and that's very important. I think that's a very important, at least from a parent's perspective, it's a very important component of the program and the supports that we provide to families is that transition, because the kiddos that did not have EarlySteps, they may not get some of the same protections or rights that EarlySteps gives during that transition process. So it actually makes sure that things are done for a timely manner for our kiddos that are in EarlySteps. And so I will go in and it looks like there's something in the chat. Ricky, we're not done with questions yet, Ricky. Ricky's jumping the gun, but that's okay. I'm going to go ahead and put this back up though, because if I can find back where I was, because I want to make sure everybody knows your contact information, April. So I'm putting that back up. Let me look at the chat. So what do we have? Oh, Anna Kennedy. I find it helpful to remind the caregiver to check their voicemail box. Is it full and working? And yes, that is very true. So when you are making referrals, and that's something that I have to do with when I'm referring families to OCDD, which is the Office for Citizens for Developmental Disabilities. I always tell them, you know, make sure your voice mailbox is not full. And another thing we do on our referral form is that there is a spot for another point of contact, which actually, April, because we have plenty of time. So I'm going to go ahead and pull up that referral form and the health summary, because maybe you can just kind of talk a little bit about that health summary too. So give me 1 second and let me get that pulled up, and we'll share that, because I think that'll be very beneficial for people to see what that, you know, some of the questions that we ask and what that form looks like. Ricky's got plans. He's trying to jump the gun here. Okay. So here's a copy of the referral form. Is there anything you want to say about it as far as what I was saying is this alternate contact name?
Right. That's just an additional number in case we have problems contacting them. I mean, it's okay if you don't have all of the information on this form yet, because we can get it after we contact them. Of course, name, address, phone numbers, and child's name and date of birth are the most important things. We can get the additional stuff if necessary once we contact them. And then the reason for the referral, there are some specific things on here to check, but if it's just, you know, general concern about speech, you can just check that, and that's fine. Of course, if there is any specific diagnosis, that of course would come directly from the physician that's referring. If it's, and which goes along with the health summary. So the health summary is really just for the physician to fill out. If you are a child care agency, you do not need to complete this because we will need to send this directly to the child's primary caregiver to get this information. If you have this information, if you're a NICU referring, then, you know, they could sign off on it, the physician that's in care of the child. Sometimes we get the discharge summaries from NICU, which are helpful if they have a specific diagnosis on there, especially our preemies, that we can go ahead and indicate that on there, because that will ensure that their eligibility. So, and then we update this form annually with the primary care physician. We send that for updates for that. So this form is only really necessary for the physician or hospital referring, because we will need a primary care, our physician signature, nurse practitioner signature on that form.
So I'm gonna go ahead and say, because I want it to be as easy as possible for anybody to make a referral. Just like you said, it should be simple. So on this specific, this is ours for Region 7, so it has our contact information for our SPO. I know, April, you get a lot of people that'll call you and just say, hey, I got an EarlySteps referral, and we fill this out for them too. Mm-hmm. And I do that too. I'll have a parent and somebody told the parent to call me. And so I just fill this out. And like April was saying too, like I don't need their social security number, and I don't need their Medicaid number. So I usually don't get that information because sometimes it's just easier not to, number one, but you know, I don't want, you know, just for my sake and not having records of that. So, but it also makes it easier. So like if you can fill out all this information just by asking questions, and you don't have to stop and go look up something in a file or something like that, then just get the referral sent in, I think would be good. So how about this? I'm going to do one more thing, because like I said, we have plenty of time. I know, like I said, Ricky's jumping the gun and he's ready to go, but I'm going to do this real quick because we do have people on here statewide. And you know, this is being presented by Region 7 and 8, which are North Louisiana, but we do have a lot of people in South Louisiana. So I'm going to go ahead and put, I'm going to bring up the SPO information. Give me 1 second. And I'm going to show that the Louisiana page here, just because so everybody will know where to get their own if they're in their own region. But then also I'll say that if somebody does have a question, our information, April and my contact information's on there. So if you cannot find out who your region contact is or who you should be sending it to, we're always more than happy to give you that information and direct you to them. So this is the Department of Health, the Louisiana Department of Health webpage for EarlySteps. And it's got all the good, important information. But if you scroll down, this is where at the very bottom of the page, it has our contacts. So it has the EarlySteps Community Outreach Specialist, and there's one in each region or each with each SPO. I would say there's the EarlySteps regional coordinators. So, and then you have information about the central office staff, which is the administration, and then the Louisiana State Interagency Coordinating Council information. But here it says system point of entry regional contacts. So, so this is going to be, you will pull up here, and it tells you who the program manager is, and it should have like the fax number. Yeah, this is fax. I usually email mine, so I don't know if there's necessarily always a preferred way, but even just contacting the SPO if you wanted to. And there is a way, look, there's a printable list that you can get. That's not working good. So I don't think I ever noticed that. So this is where your contact information can be. And really, if you just Google like Louisiana EarlySteps, it's gonna pull you up to that information that you need. So let's see. Okay, it's just talking about the our SPO, our intake coordinator information for Region 3. And that's good information. So I guess we can let Ricky loose now. So, and is there anything else you wanted to add, April?
I don't think so. I think if you think of any other questions, you just put them in the chat and we'll answer them.
Yeah. And we do have our information. I'll put our information in the chat as well, like our email addresses. So Ricky, it's all yours now. Have you said anything, Ricky?
Hold on.
Okay. Okay. Well, while you're doing that, I'll talk. So we're not.
We can hear you.
Yeah, I can hear him. Yeah.
Yep.
So,
okay.
So this is Richard Richardson, his official name. And I've got on here because I was kind of slacked in what I said earlier. So his current job requires him to do the current level of care assessments. And for Act 421 TEFRA. And he is the RN for our Northwest Louisiana Human Services District. So Ricky, are you ready to go, man?
Yeah. Can you?
Okay.
Did it pop up? Does it show it?
Yes, I can see it. I can't see you though.
Okay. Well, I'll pop on and off to show I am human.
Okay. All right.
Anyway, I want to thank everyone for being here. As you stated, I'm Ricky Richardson, the registered nurse for Act 421 program for Northwest Louisiana Human Service District. And I want to start off in saying, I'm not trying to jump the gun, guys. I'm just so gung-ho and so excited to teach this fine group about this awesome program. So I want to thank everyone for being here. And I wanted you to know that I've made it my goal that everyone here will be able to leave this presentation with a greater understanding of the Act 421 program. And I wanted to say that all of us here understand caring for a child or even children with developmental disabilities can be both very time consuming and also very expensive. And working with this program, I've had conversations with well over 100 families, sometimes several times. And there's an expense that I honestly took for granted and you never see listed. But when you have a child that's got high acuity needs, meaning one that has to have a lot of hands-on, in a lot of the cases, one of the greatest expenses for these families is one of the parent either has to completely quit or really cut back the number of hours they work, which creates a big financial hardship. So that's what makes this program so awesome. You know, Act 421 can become a game stopper, life changer for so many families. And I've honestly had the pleasure to witness this. And it's not required of my job, but the favorite part of my job is I can usually get the Medicaid decision about a week before they're mailed out to the recipients. And I love calling these families with the great news and just being able to be with them when they get the excitement and the joy from hearing that their family received it. And I feel awesome knowing that I have a very little bit of part of that. That's just a great feeling to me and keeps me pumped up. And I also want to thank everyone for being here, regardless of what your title is. It doesn't matter from what level to what level. I want to thank you for taking care of our recipients and for patients in general. And like I said earlier, I want to make sure that you can leave here today and feel very confident enough to go and talk to families, friends, anybody, just anybody about this program. I want y'all to scream it from the rafters and just let everybody know about these programs. So without further ado, we're going to get going. I want to introduce again, Brandy Croft. Brandy is our program monitor in Baton Rouge. She has been with this program since before the inception. She's extremely knowledgeable, very helpful, willing to assist. If you ever have any questions, you know, she doesn't mind being asked. She'll always find the answer. She's my go-to person. And you see her contact information here. I would honestly take it down because she can answer your questions. You see mine to the side. I want y'all to disregard that. If you have any questions, always go to Brandy. No, in reality, if you want to talk, send me a question, I'll answer it. Okay. As any project, the way this presentation is set up is just like you do any project. We start with the bottom, we build a strong foundation, and we move up. And that's what I'm fixing to do by starting. The first question, what is Act 421? And Act 421 is Louisiana's Department of Health's version of the federal law TEFRA that allows, keyword, certain children with disabilities to receive Medicaid coverage despite the parent's income. I want to go over that real quick, a little bit about that word certain. I want y'all to understand that no child, we want every child to apply, but not every child qualifies. There are, you know, we have requirements, you know, that we have to go through. And when we do that, like I said, you know, we don't go up there and just say, hey, we want this child and that child. Every child's offered the same opportunity to get Act 421. So we want all children to apply, and they just have to go through the criteria. And if I sit there and I told you that the TEFRA Act, which I've heard for years, all I heard was TEFRA Act, the Federal Tax Equity and Fiscal Responsibility Act. And I don't think that would, nobody would know what that means. So I'm fixing to give you a little bit of history lesson about this program because I think it's very important. It builds the foundation. Okay. In the 1980s, we were in the worst depression in the history of America next to the 1920s. So when Ronald Reagan became president, he passed the largest tax cut in the history of America. And the purpose of that is it would be now, he wanted, more money going back to the families, more money going back to the corporations, because he felt like if they had that money, they would spend. At this time, unemployment was at record numbers, closures was at record numbers, people going through bankruptcy, largest number in history. So he wanted that money to spur the economy. And actually it did. But it was just a little bit too little, too late. And that's the first time we had something called double dip recession. So what Reagan did, he met with all of his department heads, and he told them, he said, guys, for the first time in history, we're going to keep all the budgets for next year at the same rate they are this year. That's never been done. And he said, secondly, you're to go through all your programs, find all the loopholes, all the things that can be added back into it, and I hold you responsibility for getting that done. Well, when he did that, he called all the senators, all the legislators, and he told them to go and do the town hall meetings. Well, one guy from Iowa, he held one in Cedar Rapids, Iowa. Well, the meeting started at 6, and at 6 o'clock, a mom named Julie Beckett took to the mic. Well, they closed at 10. Julie Beckett still had the mic. And what she was talking about is, she was talking about her daughter, Katie Beckett. Katie Beckett at that time was 3 years old, but I wanted y'all to know at age 4 months, she contracted viral encephalitis, which, as we know, is an infection of part of the brain. And what it affected was it was paralysis around all of her breathing organs that would limit her breathing, and also around her muscles for her swallowing. So she wasn't at that time ventilator dependent, but she needed to be ventilated assisted. But at this time, the way that the Medicaid rule was, if any child stayed at home and received care, then the parent's income was used. And her dad did not fit the criteria. As we all know, the number one criteria for being declined Medicaid is income. So he was rejected. And so at that time, the rule stated that a child must be hospitalized 30 days or longer to receive Medicaid. So here, Katie, because of her breathing issues, had to be hospitalized. So by the time she was age 3, she spent well over 2 years in the hospital. And her mom said, I don't understand this. She could have a registered nurse at the house for 16 hours a day. And you remember I said earlier, one parent staying home, she said, I can watch her for 8 hours a day. And this would be a cost of $2,000 a month, where her staying in either acute care hospital or staying at a nursing facility is over $12,000 a month, 6 times as much. So President Reagan heard about this, and he used her as the poster child to get this TEFRA Act. If you go and pull up TEFRA, everything pops up is Katie Beckett. Well, actually, there was hundreds upon thousands of bills, included the waivers, was actually initiated through this act, but because she was a poster child, that's what you see. And like I said, the reason for telling you that is I'm just trying to build the foundation, where the actual TEFRA, and actually Louisiana started their TEFRA Act. It was started in, the federal was 82. We started ours in 22. And as of this date, less than half, only 24 states have some type of the TEFRA Act. Okay. This right here says Act 421 Children's Medicaid, but it's also basically the basic Medicaid requirements. You see the very first one is having to do with assets. I just stated that income was number one. Number two reason for rejection is assets. And the way that they had this work is not for the Act 421 is not allowing the parents, we're using the child's income. And of course, usually they don't have or very limited income, but a lot of them do have that asset. And at this time, I personally have had 3 families that were declined. And one I got with, and he was a police officer. And upon the birth of his child, he was putting $100 a month in the bank. Well, when the child was almost 3, she was diagnosed with developmental disability, but at this time he had close to $3,000. He was rejected. Well, I told him about the ABLE Act, and we actually have a brochure at the end. So it's, one thing I would like for y'all to tell the parents is, hey, one of the things, if you have a child that's got more than $2,000, please check into, you can tell them about the Louisiana ABLE Act. Like I said, we have a brochure later, or, if they want to do a trust, but I do want you to know that the $2,000 is checked, and that is one of the second highest reason for people to be rejected. And the other comment, must be a resident of Louisiana. Well, duh, it's Louisiana Medicaid, so we know that. Must be a citizen or qualified non-Social Security number. And the bottom one is real important. Care of the child must be provided safely in the home for less than the cost of institutional care. That's the same as a waiver. The purpose of a waiver is to have that child in the less restrictive environment. And that's the purpose of a waiver. Well, I've researched, and to let you know, very, very, very few times is care provided in the home at a higher rate than it is in an institution. Okay, on this one right here, this is just kind of a whole circle of what's happening. I just throwing that out there now so you can kind of know what we're building towards. I like to tell the parents it's like playing baseball. There's 4 bases, there's 4 steps. First, of course, is the application, then the LGEs. And to let you know a little bit, I was a firefighter, paramedic, nurse for almost 28 years. I have to keep things simple. A lot of people get confused about the government entities and human service districts. Prior to this, we had regions, region 1 through 10. But when you had your regions, the state had control over all 10 regions. The span of control was very large. So they've cut the 10 districts down into individual districts where they don't have to manage as much. They still have the eyes on them, but I just wanted you to kind of know it's no different. It was the regions instead of having all in one in case by the state. Now there's 10 individual districts. But then all of a sudden, after it leaves my hands, it goes to the MEDT team, Medical Eligibility Determination team. And that after that, they've already picked their plan. They just have to start it with the Medicaid. Okay. And like I said, I'm just trying to build the base. We're going to go through all the process, but I'm just building the base and we'll move up. This is if I had $1 for every. If I had $1 for every person that's called me, asked me, hey, Mr. Ricky this, Mr. Ricky that, I have a family member, I have a cousin, I have an uncle, what do they need to get started? Well, the very first step, you must have a Medicaid application. And these list the different ways of getting your Medicaid application in. And the very last thing, the reason we have that on there, applicants must select. Let me tell you, I've had multiple families come back after the fact that's had Act 421, has Medicaid, and they'll come back and they'll ask, hey, Mr. Ricky, I'm in ABA therapy and my provider doesn't take healthy this, doesn't take that. So my suggestion to you or to the families is, hey, before you pick a plan, check with your provider, check with your specialist, check with your doctors, check with ABA, whoever you're going to use, and ask them which one they seem to, like, which one seems to be better, and choose it ahead of time, because I'm going to tell you, afterward, it takes a while. Okay. What it states is applicants are considered for other Medicaid programs before they may pend. Explaining that, one thing that amazed me is when a family turns in an application, Medicaid actually tries their best to find a program for them. There are several different programs, and it actually does try its best to locate you with one. And what it says is, if you're ineligible for the other Medicaid, usually, you remember what I said, usually by your income or your assets, then it triggers to us if they marked yes on the box. And the box is on the bottom, and I'll explain that. When you do your Medicaid application, there's a box that states, do you have when it says you got to realize that application, I've had other people call me back, well, it says you, and I'm not the one. I fill out. It doesn't know who's filling the application out. You could be doing it for your son, your daughter, your husband, whatever. It just means that person. Does that person have a physical, mental, or emotional health condition that causes limitations in activities? Of course, that's your ADLs. If you check that box and you didn't qualify for Medicaid based on income, then it will kick it to the Act 421 program, because ours is not income-based by no means. Okay. The next step after you do the application, Medicaid will send out a level of care packet to applicants who meet the criteria, back to, like I said, when it said the word certain, meets the criteria, that have to be completed and returned. And what the bottom part goes over, and I'll go over them, is according to if you have a statement of approval or early steps, as April and Monica discussed. If you have that, that's, of course, for early steps, it'd be 3 years and under. And then above that, you go with statement of approval. That's through the OCDD entry. Then if you have that, you get these forms. And we do have copies of the forms, and I'm gonna go over those a little bit. With the statement of approval or early steps, you have the 90L, which is request for medical eligibility determination, the author of the HIPAA form, your child's medical and social form. Now, the medical and social is not fully required by us, but it's something that MDET needs. So we go ahead and send it out. If you don't have a statement of approval or don't have early steps, then they send out a different form called Health Records Request Form, the HIPAA, and the child's medical and social form. Because again, they're not already connected in the system. They do not have statement of approval or early steps. Okay, here's the forms. Monica, is this coming out okay? Can y'all hear?
You're doing good, Mickey.
Yeah,
Okay.
all good.
Okay, I'm sorry. I'm just so into it, I'm sorry. On this form right here, this is the health request. This is one that's sent out with the ones without the statement of approval. You notice it's got diagnosis. And I'm gonna go over how important these are. You see what the questions are asked: diagnosis, name of providers, therapy, hospitals. And let me tell you guys what this is also used for. If the MDET teams or myself, I'm sorry, if we need additional information, we know who to go to. We know who to send it to. So that's very important. Okay, you see to the left, I really use that to see exactly what treatment or assessment these people are getting right now. And I want you to note number 11. Please note number 11. This is what I tell every one of my families, and I said, try to call every family and tell them about the forms they're going to get and how to fill them out. I can't go specifically, but I tell them on number 11. Okay, I want you to start from the time your child wakes up until time he goes to bed and compare him to other children your child's age. I want to know how dressing, eating, cognitively they are, socially they are. I want to know stranger danger. I want to know if you can leave them. Now, this is age appropriate. If you can leave them in the house, if you're 14, can you run up and down the road? Can you leave the room with them being in there? Would they know what to do in case of an emergency? Would they know to call 911? Would they know to get out of the house? That's the kind of information I want in there. I want you to draw me a picture of that child. And in the next few, this is a recipient's family who I talked to that I told what I just stated, and this is what she sent in. And I want you to notice. Look to the right, how honestly, how thorough this form is. A non-nurse could do this assessment. I'm just trying to show you how thorough this form is. And this is one I received. Okay, look, this is number 11 you see on the right-hand side. Man, she's painting a picture. I mean, I can't draw a straight line with a ruler, but this draws a picture. This is just how thorough. Now, they don't have to be this thorough. Please don't think they do. But man, it sure painted a picture. Now, this is another one I'm fixing to show you that's the opposite. Look to the left. I don't even have a diagnosis here. So you got to realize I'm trying to make assessment on this. Look at number 11. Look at the difference. That's number 11. This is number 11. Okay, that's the health profile. Again, that's for the ones who do not have a statement of approval or do not have early steps. This is the other one that they send in. This is more about the actual social part versus their medical part. You can see some of the questions. And I'm sorry to say this, but under activities, what I tell a parent, if I was talking to Billy Bob, hey, Billy Bob, I love my children. You love your children. I want to brag on my children. You want to brag on your children. Now's not the time. I mean, if they're driving a car and they can do all this great stuff, I'm proud of them. Please don't list all that stuff right there, because people read this and it makes an assessment, and I will go over some of the things I personally have seen. Okay, look at number 23. It's basically the same number 11. It does, you can add another sheet, but you'll see how it's okay. Here's the lady that did a thorough job. Okay. Now, if y'all were looking at this, a non-nurse, you could be able to tell, oh my gosh, G-tube dependent, goes into it. Gives her a list. Look at number 23. Okay, this is the other one person that's, you'll see very little. She actually wrote a little bit in there, but I'm just trying to say, the reason I bring up these forms, let me get off the one in particular and just go to, okay. But they use these forms is I can't go into real specifics, but I had one that when I first got the medical equipment, I mean the medical list of what's going on with this child, when I download the medical information, the first part was about a 50-page hospital report stating that this child had been in the hospital for 6 weeks, of which 4 completely knocked down, meaning intubated in a PEG tube, because the child was having just intractable seizures, one after another, hundreds upon, and they were trying to rest her, so they had her knocked down. But then when came back up and taken out of the hospital, 2 weeks after she was released, she sent one of these in. And when I read it, I thought this person had an S for Superwoman on the chest, meaning, oh my God, this can't be that person. This person marched in a band. She could take her own bath, could even shave her own legs. Well, I knew this wasn't true, so I called the parent. Well, it wasn't that she could march in a band. She was in a wheelchair and had to be pushed. That wasn't stated. When she as taking the bath, this girl, the mom had to, and the dad had to put her in the shower, put her in the tub, I'm sorry. They had to regulate the water. She knew, she didn't know temperature regulation. And they had to put shaving cream, had to hold the rays, and her hand touched their hand. But her mom said independently. Well, you can see these are so red to the MDET team picked up on that. They read these things. So it's very important. And so I'm only saying that to say that these forms do matter. I want them to take the time. They don't have to be as complete as that other one, but the more it is, the better it helps us. And when I get through review, it has to go to the MDET team for final decision.
Hey, Ricky.
Yes.
Just because we've had conversations about that a lot, because I do get parents that I'll call and I'll make a referral to EarlySteps or a referral for OCDD, referral for something. And then once somebody reaches out to that parent for that referral, they'll say, oh, the parent says, oh, I don't have any concerns, or, oh, I don't need that. But so just like you were saying, like the most common thing I get when I'm talking to parents, and mostly I'm talking about it for the sunscreen, but you'll say like, can your child bathe themselves? And they're like, oh yeah, no, they take a bath by themselves. And then when you start breaking down the task as far as, can they turn the water on themselves? Do they do it on their own without being prompted? Can they turn the water on their own? Can they get their towel? Can they wash themselves completely and then rinse themselves completely? And, so when you start breaking down all those little tasks, it's just like you said with you saying, don't brag. You got to really just make sure that they know, all of their abilities or where they have deficits. I did want to, there is a question in here, Ricky, and I know it might come up later, but I wanted to answer it, or see, not me, have one of y'all answer it. So the question is, what if a family with a child with a disability qualifies for basic Medicaid due to not having a job, but later gets a job? Would the child lose their Medicaid services briefly, or would Act 421 be considered before dropping any kind of Medicaid service? And it says, I have a family that keeps losing their Medicaid services when the parent's income status changes during the year.
Well, the first thing I tell everybody, and I mean this honestly, and I tell them, I'm not Medicaid. I don't want to answer you wrong. So please call Medicaid and I will hook them up with Medicaid. But Act 421, when it comes to the income, is the same as Medicaid. I mean, it's going to be based it's not a special program that now, are you talking about the parents' income?
Yeah, the parents' income. So the parents, like maybe the parents work seasonal, maybe they're in the tax industry, they do taxes. And so they work seasonal. So their income may fluctuate throughout the year and they're losing their Medicaid coverage.
Okay, this one is not based on the parent's income. So this one is based.
Right, but they're asking, but they initially, the child was eligible under the, because the income was under the, under the max limits.
Oh,
so the
okay, I see what
child
you
was eligible based on income, but then the parents start working full time or they work their seasonal job.
If in that case, if that child qualifies for Act 421, that person needs to go under Act 421.
Yeah. And would it be seamless? Is it seamless? Like, would they lose coverage and then have to go under Act 421? Or would Medicaid like automatically send it to y'all for approval under Act 421?
Okay. Hey, Brandy, step in. She's a lot. She has meetings and talks with them all the time. When it comes to Medicaid, Monica, I'm sorry. I don't want to step on anybody's toes on Medicaid. Go ahead, Brandy.
Hey, yeah, and I'm with OCDD, and I don't want to get too deep into Medicaid's rules and regs and stuff. So I would definitely say contact Medicaid and talk to someone there about it. But what I will say, and I know you mentioned it before, what we understand at OCDD is that a child, even if they're in another program, before Medicaid closes them, they're going to run them through their system and see if they may be eligible for any other possible program. So whether, depending on their age, I think the Family Opportunity Act, I think there's an age limit on that. Something I read here recently. So if the child was under, I think 13 and they have a disability, they may be eligible for that, you know, and I know that program has a premium possibly. But so if the child, you know, it comes up for their renewal and they no longer fit in one of the other programs, then the system is supposed to run them through that check. And if they have that question marked yes, that you mentioned before, does the person have a physical, medical, or emotional condition that limits their abilities in their daily living, then the system should kick them over to PEND, as we call it, for TEFRA. So therefore, they would come up in the system to be considered for this program. And then, you know, that process would start from there. You know, the packet would go out to you and, you know, you'd be reviewed from there. So every year, a person does have to be reassessed through this program. So, you know, they're going to look at that every year. Even if a child does meet the requirements for TEFRA this year, when it comes up that annual review time next year, the system is going to check to see, based on that information you return at that renewal period, the system is going to see if the child meets the criteria for any of those other programs again. And if the child does not, then they're going to come back through TEFRA for their annual reassessment. So that's my understanding. At each renewal, the system is checking to see if they, you know, what programs best fit that family situation, that child situation. But here again, I would recommend talking with Medicaid, because I know you said that the person is losing coverage, and then they're having to, you know, go back through that whole thing again. It should be seamless, is my understanding, just by, you know, like I said, the system, before they close a person, the system should check to see if that child meets any of the programs that they have available. And they have so many that I'm learning about all the time, but please do check with Medicaid on that. I hope that helps answer some things.
Thank you, Brandy. I think also too, because since they just now are starting the process, like the Medicaid the public health emergency unwind and all that kind of stuff. So I think that's something that might definitely come up more and more as people are determined ineligible. So thank you for that.
Okay, was that Mandy's question? I know it disappeared off of mine. So
let me see.
And she was saying she had stepped away. Mandy, did you catch that? What I was saying about the.
I had to.
So.
I don't see Mandy's question at all.
Okay.
How is a child reassessed? That's it. I think.
Yes. So if you missed that, if a child has Medicaid coverage and then the parent does gain employment, for example, as Monica mentioned, maybe someone who prepares taxes, that's a seasonal position, and then they have to report the income, and then the child may lose coverage due to that income. So if that question regarding physical, you know, the person having a physical, emotional, or medical condition that affects their daily living activities, if they said yes on that question, on the application, then before they lose coverage, then they should be considered for TEFRA. So the system should look at them for all the different programs under Medicaid. And if they do not meet the criteria for those other programs, then they should come up on the TEFRA list. But please do check with Medicaid and you know, talk with them about that. As far as, and what I was saying too, reassessments every year, a child will be reassessed to make sure that they still meet the criteria for this particular program. If they do not, for some reason, you know, the child's health has improved to the point where, you know, they may no longer meet one of the level of care pathways, then Medicaid would still look at those other programs to see if they may fit those.
We do have a couple of more questions, but I think that we can definitely answer those. Let's let Ricky get through, because he may even answer some of these questions. And so we just broke a stride there. So let's let Ricky get through, and then we'll definitely, but so keep on, like, as we're going through and Ricky's
Man,
going.
I'm up here just rolling, trying to get these people out before 4:30.
Don't say that, Ricky, stop. People are gonna really think they're gonna be here till 4:30.
Not.
Continue, Ricky.
The next form, before I was rudely interrupted, is the 90L, the request for medical eligibility determination. This form is required if somebody has the statement of approval or the early steps. And this is for to use this one, and I'm gonna go into that. There's 3 routes to get, I would say, through me, meaning the LOC, to get through the LGE is, and this is one, is immediate care facility, and you must have it. And the reason that Brandy marked these is a lot of these forms, when the families take them to the doctors, and let me explain real fast what this is. When I do a hospital and nursing, that's required of what I'll be read that minute. A registered nurse has to do that. That's why it has to be a registered nurse in this program. But when this one is done, I don't do the assessment for the ICF, and I will go over that specific level of care route in a minute. But that is 100%. This doctor is actually doing what I do. He's doing an assessment. He's saying that person qualifies. But when these forms are sent back in, a lot of times you'll see where mark the first one is a parent doesn't sign and date. And on the far side, the physician must sign it. Now, you can't have a nurse practitioner or a PA fill it out, but you have to have the doctor's information, who they work for or whatever. But anyway, that has to be signed also. But on this whole form, the most important box that must be checked before it gets back to us is, you'll see under level of care, section 2. And by the way, section 1, the whole area, the family fills out. And when I send this form, I tell them how to fill that out. What I just meant, they don't know what that means about, you know, previous facilities. So I send instructions on that. But on level of care, C box A requires active treatment of a developmental disability under supervision of qualified intellectual developmental disability professional. That's where the doctor's saying, yes, this person does have autism. This person does have cerebral palsy. Yes, this person has this or that. It just lets them know that this person meets the criteria for that program. So box A, we can't tell them to check that, but in order to get the criteria for immediate care facility, that box must be checked. And the reason this is up here, like I said, this is the required one to go with the SOA. If you have a statement of approval or early steps, this is the form also. When I get this, I can process it and send it back to send it down to the MDET team. This is a HIPAA form. It's common form used. We have that filled out because if you remember on the health profile, it's got hospitals, providers, or even schools get an IEP. I have sent multiple ones to these providers requesting information. I also try to tell the family the time periods to send in, how to fill it out in general also. So I really don't mind if y'all have a person who's worried about the paperwork. I'm not just saying this, please have them call. I love dealing with the families. I love it. And I also really like helping them with the paperwork because, hey, it can be confusing. Okay. Getting to this slide. I tell people when I was a fireman, when you catch a hydrant coming off the street, the fire hydrants, that's one hose. Once it gets to the fire truck, it breaks into 3 different ways. You know, the ones that go in the house, the ones that supply certain ones. And the reason I bring that up is when it comes to level of care, you have 3 different ways of getting there. And that's on the next slide, but they all end up the same way. And so what this means is after you've turned in the Medicaid application and it's been received, they'll send us a dashboard message saying, hey, Ricky Richardson's plan's ready for review. So you've already passed the application process. All that's in. That's where I get this. And I review it and try to determine which way to go. And let me explain something. It says our staff will contact you within 14 days. I've usually made contact prior to that because I have a list that's got the parent's name. I usually call them ahead of time. And let me tell you why I do that. Number one is I love helping the families, of course. I try to help them with the paperwork before they send it in, but also to let them know the more information you send me and to the state, and I give them the website where to download, the more information you give us, make it so hard that Ricky and MDET team, we can't say no. Just give us so much information that, you know, we're just overwhelmed with it. We can take information back for 12 months. MDET can take it up to 2 years. But let me explain something. If you've got a pertinent information like, oh man, I had my psyche about 5 years ago. Well, if it's pertinent like that, please send it. Have your family send it because I can put reference only because I have to list what sources I use to make my decision. So if they had hospitalization 3 years ago, go ahead and send it. I can put hospital records, Willis Knighton, Ochsner's, Highland, whatever, reference only. So please, you know, that's what I do is it says within 14, I'm in the negative because I've usually contacted them. Okay, this is where I was talking about 3 and 1. The 3 here is immediate care facility, hospital level care, and nursing facility level care. And I will go into each one, but I want you to know that all 3 end up the same place. We don't differentiate how. Once it ends up past me at MDET, they're all reviewed the same way. There's just 3 different ways. I do the reviews. A registered nurse is required for number 2 and number 3. The number 1, you know, going back to catch you up that's where the 90L, that's the doctor doing the assessment. Okay, the very first one, immediate care facility. Again, if they're 3 through 18, they have to have the statement of approval. And let me tell you how that works. I failed to mention this, I'm sorry, but I think to be successful at a program like this, you got to have your contacts, you got to have your connections. And my connections with EarlySteps April and with our entry team is phenomenal. They are so helpful to me. They make my job so much easier, and I want to thank them and thank them and thank them. It really makes it easier when you have a great connection with them. And Monica will tell you, I'm always contacting her, and I'm not even include Brandy. I wear her out, but you know, but she's a wealth of knowledge. So again, if y'all need anything about this program, contact her. But if they have what happens is, if I get to let y'all know, a lot of mine come in, they do not have a statement of approval. They do not have early steps. If they're under 3, I can't do this, says I must refer them to early steps. But if they're 3 and older, that and they have, I'm just using, for example, they have autism. Well, I will actually look at their plan, try to see what their weakness is, see how many substantial function limitation, you know, the eating, the grooming, the dressing, the mobility, the transfers, dressing, and see how they are. Read reports, talk to the parents. I always do parent interviews. I always do teacher interviews. See what they can do. And if I can't find that, even though I will refer them to entry, and I'll get with entry, tell them what's going on, and set up an interview with them to try to get them a statement of approval. In the meantime, they didn't have an SOA, so they was not sent the 90L, the request for medical eligibility determination. I will send that, the one on bottom. I will go ahead and send that with them and say, hey, in the meantime, while I'm waiting on the statement of approval, go ahead and, because it takes time to get this set up with your doctor and get them to do this, and I'll send instructions. So I wanted you to know, on this one, they usually have an SOA or early steps, then they must have the 90L. If they do not, then I will refer them myself. And once I have these, I can send it on. And to let you know what that means about ICF, in order for these people to pass the criteria for immediate care facility, for hospital or nursing, that means in this one, that person meets the criteria for that day. If something happened, they could be placed in immediate care facility, i.e. group home or whatever. They must meet that criteria before they could be put in there. It's just not, oh, well, they have autism level 1 and they can do everything. Well, you know, they wouldn't pass my criteria for that or statement of approval. So I just wanted you to know that that's the process. Once Medicaid, to kind of reiterate, once Medicaid gets the application, they'll spin it, try to find some type Medicaid source form. If not, if they've checked that box showing the person has a disability, then they'll send them a packet out. If they have a SOA, if they have your SOA or early steps, they send them a certain package that has the child's medical and social, the 90L and the HIPAA. If not, and they check that box, they'll send them out one that has the child's medical and social, the HIPAA, and the health request. So again, and then once they send that, they send it to me. I do a review, and there's 3 routes. I'll look at what I have, and I will let you know honest truth. I absolutely try to find every way possible to pass every child. And Brandy will tell you that it breaks my heart when I cannot. I look for everything. If I can't do it, I try to get it with entry through the statement of approval. Okay, that's the immediate care, which, like I said, they have to meet the criteria to be placed in an immediate care facility. Okay, hospital. That's the big boy. These are your high acuity patients. All that first part says, in order to do that, you have to have a nurse to do this. And I like to start in the very bottom one first for the hospital. It's a health condition that's unstable, presenting constant potential for complication or rapid deterioration, such that the child requests monitoring in order to detect unstable or life-threatening conditions and respond with appropriate care. They're the ones who need nursing care, are, I must say, some of the very best RNs I've ever met in my life. All my years of being an ER nurse, all my years of being paramedic, some of the best nurses I've ever met are moms. These moms can do peg tube, trach care, suctioning, awesome. So this just means that this child is, may have trach and may have, suction wrist. They may have to where they have peg tubes. You got to check that. They may need IV meds. They're just pretty bad. And it usually, let's go to the top one where it says they need the use of equipment. It may be heart monitoring. It may be pulse ox, may be oxygen, could be your trach. But the main thing with the hospital over the nursing is it requires the use of equipment for life-threatening conditions. And like I said, they usually have nurses at the bedside or a mom is responsible for that. So that's your hospital level care. And like I said, that has to come through me. So that means that at any given moment, that child meets the criteria that they could be placed in an acute care hospital, not a nursing facility, but acute care hospital. The nursing facility level care, this is my most prominent by far between that and the hospital. And again, it states that a nurse has to perform it. And look at the bottom one again, requires skilled nursing interventions or have substantial functional limitations requiring hands-on assistance. These are children that need assistance with, the bathing, the grooming. Now, with a hospital, they're usually 100% total care. Everything has to be done. And these, they may have to have oxygen. They may have to have a pulse ox. They may have to have certain things, but they also need, maybe bathing and grooming. They may not have to have total care, but they do need some hands-on care. And on the top one, what that says, these are automatic passes. If a child has a terminal condition, meaning that it's usually going to be life ending within 12 months. If they have a transplant, any type transplant pending, they have stage 3 or 4 cancer. If they keep having different cancer, or if it's post-transplant, I've had a few that's been post-transplant heart. Well, it has to be within 12 months because, they could still have any type of rejection. Again, it's any terminal condition, usually meaning that the child, won't live past 12 months. Any type transplant pending within the 12 months, stage 3 or 4 active cancer, and somebody who has recurrent cancer or a transplant within the last 12 months. And the child has a diagnosis of medical/physical condition results in the need for long-term services for at least 6 months. I'm sorry, on the hospital, it also you had to have it. It's going to last at least 12 months. And one thing that I wanted to mention, I failed to mention a while ago, I'm sorry, is that these people that have this, I have a few scenarios that I've had to deny, and again, I hate it. If somebody has a illness that can be treated, and like let's just say asthma, well, they could take their inhaler or whatever they can do. If it can cure it, even if it's in the acute phase, if they can take a treatment and or a medicine that can fix it, they have seizures. If they can take they hadn't been on the seizure medicine, if they can take that, they take something that glucose, and they can take D50 and it can cure it. Well, anyone that can do it, that doesn't meet the needs if it's not acute. It has to be, over at least a 6-month time period. And when it comes to a nursing facility, that person that day meets the requirement that they could be placed in a nursing facility, not acute care hospital, not immediate care facility, nursing. So again, the 3 levels of care, they all go to the same place, end up the same place, is immediate care. That's your group homes, the one that requires a 90L. I don't do the assessment. I do gather everything and send it down. I have to make sure the 90L's been signed. I have to make sure the right box is checked. I have to make sure that they do have a current statement of approval, which Brandon do a great job letting us know yes or no on, does this child have a active statement of approval early steps? So thanks for them for doing that. Hospital, of course, could be put in a hospital that day. Nursing could be placed in a nursing facility that day. Okay, once I get my assessment, I send in something called a 142, not to get off on numbers, but all that does is lets Medicaid, hey, Ricky's through. Yes, he approves it. We're going to send it on to the next level. I have to send the family a letter. I love doing that. I just let them know, hey, baby, we're going. We hit second base. We're rounding the base, headed to third, which I hope LSU's doing as we speak. But it moves them, like I said, second, we're headed towards third. Okay, I send them, and unfortunately, if they do not pass, the worst part of my job, remember my funnest part is calling the families and letting them know. The worst part is sending a denial letter. I sent 2 yesterday and I hate it. I hate it. Again, what it means is, but I tell them, one thing I tell the family ahead of time, hey, I'm denying you, but please understand, I'm not denying you Medicaid. I'm denying you Act 421 program. Not all Medicaid, just this program. And again, if it's approved, it's forwarded to medical eligibility team. And again, you see on the bottom, it doesn't matter. They all receive the same coverage. And let me explain something. When it comes to the MDET team, you know, they just don't grasp at straws because they do all the Medicaid approvals. So they stay swamped. But one thing they do is they don't just grasp things out of straw because they'd be sued right and left. Yeah, let's approve this. Let's not. They actually follow the SSI eligibility guideline to determine eligibility. You know, they have to have some guidelines. But please note, people say, oh, does that mean I get money? No, this is not the same as getting the money. That's through federal Medicare. You know, Medicare's Title 18, this is Medicaid's Title 19, different programs. It just means they use that criteria because they have to have some to use. Okay, we're getting close to the end, guys. Okay. If the level of care is approved, determination will be by Medicaid, the MDET team, unless, you know, some kids that come to us have already been, I just had one yesterday that was already SSI approved. So what this means is when I send it down, this MDET team, when it puts it in, they'll see, hey, this person's already been through this. They rubber stamp it. That's a great thing. And again, you remember the very first slide said certain children. Well, this is you've made it. If you meet the financial and categorical eligibility requirement, that's the criteria I was talking about you have to get through, then you're enrolled. And again, this numbers list is Medicaid. When she asked me that question a while ago, I'm very knowledgeable about Act 421. And when it comes to Medicaid, I instantly, hey, look, I am so sorry. You know, I don't want to tell you wrong, steer you wrong. Here's Medicaid's number. Please contact them. Okay, this right here, this is a nasty word. It says appeals. It's nasty. I do not want one of these. When I do a denial, you have to send them the letter, and it also has the information to go through for an appeal. That just means they do not believe in your decision or in MDET's decision. Now, one thing I can promise you, I keep them well informed throughout the process, and I try to tell them, hey, ma'am, I'm gonna let you be honest. I do not, this is not a developmental disability diagnosis. And it seems to be one that I get all the time, but, and I'd love to know. So when it comes down to me getting a denial, they kind of already know, and hopefully that helps. Okay, this wild looking chart right here looks like my writing, but I'm gonna let Brandy explain this. It's actually not as hard as it looks, but Brandy's gonna step in. And so my time is through. Thank y'all so much. And I hope this allows you to, learn a little bit more about Act 421. You can call anytime you need. My number's listed for questions. Ask Brandy, but if you need something else, call me. And thank you so much.
So I added in this slide for just to give you a picture of the process, and I know it's kind of confusing, but there are the arrows to follow there, starting with the applying for Medicaid as a whole. This just gives an idea of about how long the process should take from application through the level of care process and on to MEDT's decision at Medicaid, and then their notification of their decision. So if once you apply and Medicaid looks at the possible programs that the child may meet that criteria, it shouldn't take more than about 30 days for the process. If Medicaid receives the information that they need, so once a child pins for TEFRA, once they are determined that they may be eligible or may meet that criteria for this program, they're going to send that triggers their system to send that packet that Ricky was talking about. And it's going to depend on whether you have a statement of approval or EarlySteps eligibility or not. And so then they'll mail out that packet to the parents to complete and get back in. And depending on how long that takes for that to be returned, that's going to determine, when Ricky's notified or that other local government entity, Human Services District or Authority is notified to move on with the level of care. Sometimes they do need more information, as he said, that he sends out that HIPAA form to the providers, whether it's doctors' offices, therapists, schools, and sometimes, one thing I do hear a lot of is that it takes a while to get those documents back from the providers, and that information it's really pertinent to the Human Services District and authorities for them to be able to make that determination as to whether they meet that level of care for one of those pathways, so they can move it on to Medicaid for their review. I did want to make one point though. Ricky was talking about some of the conditions or diagnoses on the nursing facility level of care. There are some that, as he said, is like an automatic pass on that. So if a child does have stage 3 or 4 cancer or reoccurring cancer, the automatic pass being they pass that level of care, they meet that level of care, therefore he can pass it on to Medicaid's review team for them to determine if the child has a disability based on the Social Security Administration's definition of disability. So there are no, for this program, there are no automatic conditions or diagnoses. So whether it be one of those, MEDT still has to make that decision. If a child has autism, level 3 autism, we've had a lot of questions about that. Parents have said, they've heard that there's, automatic approvals for children with autism or muscular dystrophy, cerebral palsy. They still all have to go through the medical review team at Medicaid. So please just know that. So basically what the LGE or Ricky and others at the regional offices, what they're doing is they're screening and doing these assessments for this program, because there are certain criteria that you have to meet specifically for this TEFRA program. So that's what their part of this process is. There was a question about renewals. I think it was in addition to some other things I mentioned
answered
before.
most of them. So hold on.
I was going to mention too, so I know that families are starting to get those renewals with Medicaid. So what happens is when it's time for the child's renewal, I know things are a little bit different than this year for Medicaid as a whole because of the end of the public health emergency. They're trying to do that unwind but every family will receive a renewal packet and information from Medicaid, and that's for everyone who has Medicaid, not just this program. So you're going to receive Medicaid's renewal information. They do require that information to be completed and returned, along with some families may have to complete the packets of information again, depending on whether you have a statement of approval or early steps eligibility or not. You may receive that packet again to be completed and returned as well. So please do be on the lookout for that. It's important to get both sets of information back in if you do receive the two packets, so Medicaid can notify Ricky and the others to move forward with that annual assessment.
So does that include doing the 90L again?
It could. So if the 90L is older than 12 months for this first renewal, if the 90L is older than 12 months, then they will have to have a current 90L completed by the medical professional. And they would Medicaid to you. Go ahead.
So I think you really just answered Mandy's question where she asked how it will be done. So they're going to mail you a packet. And then also, and this is one I didn't know, and I think it's an interesting question. But she asked is there a study being kept and or assessed on those? And I would say this would either be under, is OCDD doing this? Since you're with OCDD, we're asking OCDD if they are, if a study is being kept and or assessed on those persons or children who have qualified for Act 421, the level of care as it relates to age, gender, and ethnicity. I totally can't hear you, Brandy. It doesn't say you're on mute. Is it just me? Can anybody else hear her?
I can't hear her.
Okay, good. It's not just me. I think she's frozen now. Yeah, she might just be having technical difficulties. Yeah, she just dropped off. I'll give her a second, see if she gets back in, if that makes any difference. I'm seeing she's still trying to get up. So, okay, I'll go ahead and talk about the other question that was up there. And I think it was something, we're kind of going back to where it says, why don't we set up workshops for parents who may be academically or mentally challenged to fully explain about Act 421, explaining in people-friendly terms, explain who qualifies and what criteria is needed to qualify. And I will say we've already done that. We're ahead of you on that. So I know that our Families Helping Families Region 7, we've had a TEFRA Act 421 workshop for our parents. And you know, as the need arises, if we have parents or people or professionals reach out to us and say we need more information, we definitely can do that again. I don't know if Stacy's region has had one, but I know that there is a parent center that works statewide, and they've also had it. So it is available, and what we really rely on is professionals that are working with those families, making sure that those professionals working with those families get that information to them. When we have workshops or trainings with Families Helping Families, you know, we need y'all to share that with the parents that y'all see a lot more often than we may. So, because it's a part of, just like EarlySteps, it's a part of educating the family, you know, is a part of what that program should be doing. So at Families Helping Families, you know, we want our parents to get the best information possible to make sure that they have all the supports and services that they may be eligible for. Has Brandy come back on?
No, hey, Monica.
Go for it, Ricky. Keep on.
To also what she asked, let me explain something. When, and I want y'all to understand this, when a person applies for Medicaid and they're rejected and they're put on a list and they were sent a package, I get that list. Right now I have 320 something names, that's families on my list. I have probably, Lord is my witness, contacted 250 to 275 of those families. Now, that's not required, but I do it. That's part of what I told you. I contact. Remember, it said I had 14 days, and I always go in early and I talk to them. I go in there and I explain. So to answer that question, I literally have had so many families come up here and sit down in my office, and I do that I do go over the many times. I've had several families who come up here that don't know how to download, or they try to use their phone, and I let them, you know, help them download. So that's not direct going to new families and stuff, but everybody on that list, pretty much I've contacted, and I go over, okay, listen, these are the forms, this is how I need, if you need any help, and many times I have helped those. So I try to do as much outreach as I can. Of course, I have a big caseload to keep up with, but I do that, you know, at a local level. Now, she's right about getting that state. That would be excellent. I mean, this family, this program from the start to now, I was getting one name every week to 2 weeks. Now we're getting 10, 15 a week of families. So it's expanding, and as doctors learn, everybody else. But you're correct about teaching, but I try to do as much as I can individually on that subject.
Yeah, it's a lot of work. It's a lot of work doing that too.
And hey, she wants me to go over, does it show the ABLE? Is it
Yeah,
up?
I'm showing the ABLE, yeah.
Okay. what this is about, y'all remember me telling you the number one reason to be denied Medicaid is based on income, of course, we know that. Second is assets. And what happens, like I said, is when they go to this program, they don't count the parent's income, they count the child's. So many families go and they put money in account. I did it when I was a fireman. I put so much per child in the bank, you know, and so this account allows you to do that up to $17,000 a year, to where that child, it's that nothing in this account is counted against Medicaid. It's almost like a trust. A trust is just more specific about what, who, what, where, when, but this is an account. It's actually, you can see through the disability rights. And this brochure, if y'all want to take a, I don't know, picture, snap, whatever of this information, this would be great to contact. I have referred many for anybody to keep them out of having to worry about that, because luckily those 3 people I mentioned that I personally know that was denied, through this, they were able to get back on track. It just took 30, 60 days to get back in that track, to get the money out, get it in here, blah, blah, blah. But, you know, this information is related to the assets of the individual.
And Ricky, that is something families helping families across the state. We do a special needs trust or special needs planning, and learning about
Great.
able accounts and special needs trusts and things like that is a part of that. So,
Okay.
and we just recently had one last week. Was it last week or the week before? It was just recently.
Okay.
So, which actually it was us, it was Region 7 and Region 8 that both combined on that.
That's good to know.
Yeah.
I'm sorry, y'all. I am back in. I think if you can hear me, I lost connection and I had a hard time getting back in. But were there other questions I might need to address?
Yeah, the one question though, Brandy, is OCDD collecting the data on those?
Yeah.
They are.
Okay. Yeah. So we do try to we track that as far as ages. Yes, we keep demographic information and report that. I think it's each quarter to DD Council and different ones. The Assistant Secretary, she shares that information. So yes, we are tracking that information.
I know EarlySteps, the SICC, she's the program manager for EarlySteps usually reports that information too, like on the numbers, not necessarily race and ethnicity, but on applicants and approvals and things like that. So.
Yeah, originally when the program started last January, the first couple of months, children that were under 3, the 2 pathway options that they had were hospital and nursing facility. And we were not using the EarlySteps eligibility at that time for the ICF pathway, but you know, based on some different situations, you know, we had families report, you know, they weren't meeting the nursing facility level of care or the hospital, but they did need a lot of assistance in areas. So anyway, we met and discussed that, and that's when we did begin using the EarlySteps eligibility for the ICF pathway. So I think it was around March of last year. So that's
Another reason to make sure
yeah.
children are being referred to EarlySteps.
Yes, and
it makes it easier for Ricky to do his job.
Yeah, you know, and another thing too, I wanted to bring up too, for providers, and if you know that the family, the child is in EarlySteps and they are getting close to that age 3, please do encourage them to go to their Human Services District or Authority and apply for those services, because I came from Northeast Delta Human Services Authority. I worked there for many years, and the sooner that you can get connected with them and go through their systems entry eligibility, the better. That just opens up access to other resources that you might not need today, but you might need it in a year or so. Hopefully, you won't, but if there's things that they can assist with connecting with other resources, they have funding at each LGE to assist families with maybe a few hours of in-home care, home modification, equipment, devices, those types of things. The child can be placed on the waiver registry. So if at some point they're needing those additional services, whether it's in the home or for a children's choice waiver, they have the funds there that they can use it for vehicle modifications or home modifications. They have another program, the Flexible Family Fund, for children up to 18. So it just opens up, to other resources. And if you've already gone through that process, and then you can go ahead and move forward if something does come up. Otherwise, they would have to take that time to go through eligibility, and it just kind of prolongs the child getting what they need. So I just want to encourage people to please do go through the systems entry process for the eligibility determination.
Is that it, Ricky? Are you done? So we had a couple of questions, Mandy asked a couple of questions. And so Mandy, it really depends on what region you're in. I know I have parents that will come into Families Helping Families, will come in and have a meeting with me, and I'll make sure, because sometimes I know, sometimes it takes those visuals to, have that handout or that piece of paper, and then also being able to see somebody to know, okay, that's who I'm calling, because you have so many people that are calling you and asking you questions. I have never seen where a parent didn't remember Ricky's name,
Hey,
but often I get parents that are applying for things or going through. Maybe they were approved for their TEFRA, or maybe they were approved for a waiver, and they don't know who's calling them. So Mandy did say, is it possible to have like an in-person appointment? And I don't know that that's necessarily specific for a question for you, Ricky, but I think that would be more for a Families Helping Families, because we're the ones that have we work with all the different programs. But I know, and speaking for me, and I don't know if Stacy does this in her office, but we have had parents come into my office, and I would talk to them and show them and make sure they're getting referred to all the programs and have all the supports that they need. So, and then.
but in my case, I will anytime I will make time for a family. Anytime, it does not matter.
Yeah.
I'll find time.
Stacy said that too. And I always tell Ricky, and I know how you were talking about saying that relationship, just because I am the EarlySteps community outreach specialist, it doesn't mean that I don't work with all ages, because I do. I'll work with families who have kids with all ages, or, and sometimes occasionally I'll work with individuals. So, yeah, Mandy, like I said, I'm not sure what region you're in, but if you reach out to your Families Helping Families, then that could be something you could call the office and ask if there's somebody available to do that. I'm going to go ahead, and Ricky, this is your last slide, isn't it, Ricky?
Yes.
Okay.
There's references, but hey, tell Mandy I'd even talk to her if she came up here.
Ricky, you'll talk to anybody. I'm going to go ahead and pull up our other thing because we are at the end and I want to make sure everybody knows how to get their certificates if they need a CE or if they need just a certificate. So, which I'm having to go through all this again. Going back, let me go back because here we go right here, Mandy. So this, if you can see, this is a list of all the families helping families across the state. So if you know what region you're in, even if you just say pick one and it's not the right one, anybody who answers the phone at any of these would get you with the right one. So, or you can always call me and I can get you with the right one. I have no problem with that. Okay, so a couple of, before I give you all the information on the certificates, we do have a couple of presentations or webinars coming up. There is a webinar on June the 8th. That's the very next webinar that we're having. It is a statewide webinar and it will be on families helping families across the state. So that kind of like, we've given you some information and we've tried to paint a picture of what some families helping families do, but this will be addressing what we are doing statewide in the different centers. So that's June the 8th. June the 16th, which is a Friday. I think June the 8th is not a Thursday. I'm not sure. I don't have my calendar in front of me. But on June the 16th, which is a Friday at noon, I have Be an Advocate. And so this is, you know, early childhood. I am doing it as a COS. But it is to try to educate parents and support parents on being an advocate, like making sure that providers and professionals that work with them know the proper information, just like Ricky was saying, and he kept saying about when you fill out something on your child, make sure you overload them, give them more than what you would think that they would want or need, you know, and then also like knowing that a parent knows their child better than anybody else, and making sure that they have a voice and they can advocate. We're talking about advocating for systems change, because I will have my LACAN person come on here, advocating for like healthcare services or healthcare supports and even educational services. There's a parent who has special needs, there's a lot of advocating they have to do. And so that I'm hoping that this will address and help some of our parents. And then on the 23rd, June 23rd, we'll have a Region 8, Northeast Louisiana Families Helping Families. It's My Life, How Do I Want to Live It? Which I'm excited about that. I'm gonna definitely be on that. And just, it's talking about educating and empowering individuals about their plan of care. So when they have either a Medicaid waiver or where they have, even I would think this would even work for EPSPT plan of care. You know, just making sure that that plan of care fits the needs of the individual. So these are all coming up on mine. There are some links here. The tiny URLs are on there for if y'all wanted to jot those down real quick. You could do that. Let me do this. I'm gonna put this in the, I'm putting this in the chat now because some people like to do it in the chat. So that's the link for the survey. That's how you're gonna get your certificate. Let me make sure I have all of our questions answered. We're looking good. So if y'all need more information on any of those webinars. Okay, here's the last thing you can scan. Also the QR code that's on the screen now, that is the link for the survey. So you have to fill out the survey to request your CEs or your certificate. That's the only way you can get them. So eligibility for CE requires attendance from the entire event. I know we're a couple of minutes over, but the entire event and completion of the evaluation. So also make sure that it says the completion of the evaluation, make sure you fill everything out that's required on that evaluation. Just like Ricky was saying for parents to do with the TEFRA application, do this for your CE request. Like make sure we have all the information we need to be able to email you that request, and then make sure that we have the proper name on that, because you know, if you just put your email address, it may not necessarily reflect what your proper name is for your credentials. So we need to make sure that you're filling out that information completely. And then Also on here, I have our, if you do need any information, any follow-up, Stacy, I kind of left the certificates up to Stacy. I think they said that the turnaround should be around 3 weeks. Am I correct? Do you remember
Yes.
seeing something? Okay. Okay.
Right, that's correct. We're
Okay.
going to try to get them out to everybody next week.
Okay. Okay. But it could be because I think it said 7 to 10 days or something like that for like Bureau of Family Health to get us
Oh,
that
you're right.
information.
You're right.
Yeah. So if it's not a week, it could take up to 3 weeks, just so everybody knows. Because I know sometimes like we might get a call Monday saying I didn't give us, and it's not anywhere near being completed. So just kind of give y'all a time frame. You should, if it's been more than 3 weeks and you have not received it, then definitely call us, pick up the phone and call us or email us and just let us know and we'll investigate for you. So I appreciate Ricky. I appreciate Brandy. I appreciate April, and I appreciate you too, Stacy. I think this has been fantastic, and I think our providers, we had great turnout, and I think that, and I'm hoping that everybody got the information that they needed, especially about TEFRA, and that everybody's more confident now about making referrals to EarlySteps as well. And I have on here our 2 families helping families. Ricky's trying to go to LSU game, so that's why he's all excited. But I do have our families helping families information for me. I'm Region 7. I'm Monica Stampley, and I've got my phone number on here. And I did earlier. I put my email address in the chat. And then Stacy, which is Northeast Louisiana. That's Region 8, and that's got her information, her phone number, and her email. So unless I don't see any other kind of comments or questions. So I think everybody is ready to go home. It's Friday. Ricky's ready to drive to Baton Rouge.
Monica, you may have already answered this because I was trying to get back into the webinar. Sandra had asked about if they would be able to get the slides from this. Will y'all be able to share them?
We can definitely share them. I don't know if there was a spot on there, but we can share them. And if there's something comes up, is it okay? I mean, at first, though, these are OCDD slides. They're your slides. Is it okay if we share them with our participants?
Yeah.
Okay. Yeah. Then it shouldn't be a problem. No, I did not answer that, and I'm looking back now just to make sure that there wasn't anything else that was skipped. So yeah, we can go in and have those sent out. So guess that's it. I did if you have not gotten your survey link, there's fail safes. We try to make it as easy as possible for you. Like I said, the survey is in the it's in the chat. There's a link in the chat you can click on. You can scan on your phone and do it on your phone by scanning this QR code on the screen there. Or also sometimes it pops up. If you're on your phone, it's not going to pop up after the Zoom meeting, but it should, in the follow-up email, it should be sending that information, the link for the survey. But we really want you to do it now and complete it now so that we get it all compiled and ready to go. So if at all possible, make sure you do that survey. That's the only way to get your CEs. And I think that's it. Thank y'all again. I appreciate y'all spending y'all's Friday and doing this for us.
Thank you.
Happy to help.
Bye.
If anybody has any questions, I'm happy to try to answer them or find the answer.
Yeah. Thanks.
All right. Thanks. Bye-bye.
All right. Bye-bye.
I'm out.
Bye, Ricky.
Hi, Ricky.
Bye.